Welcome, everyone. We're back for another interview during this pandemic, and I am here with James Luckett, and it's okay if I call you Jamie. That's how I know you.
It's fine. Absolutely is.
Jamie is a friend and a member of Royal Lane Baptist Church, where I am the pastor. My name is Mike Gregg, and again, it's good to see all of you again. And Jamie is here. He has been a member of Royal Lane Baptist Church for over 30 years with his wife, Melissa. And he is the Wellness Center Manager for Premise Health. And he's been there for about 3 years now, but he can tell you a little bit more about what he does. So Jamie, what are you doing right now in your field, and how has it been affected by the current pandemic?
Sure. One thing to correct, I've actually been in this location for about 17 years. So I worked for major defense industry leader and worked for them for a period of time, and then management changed, and so now I do work for Premise Health, and still feel very fortunate to be here. I serve a population of about 4,000 very bright people in the work that I do. It really does take a rocket scientist, and so I'm able to help look after them and take care of them and to meet their needs while they're on site. I have 4 other staff members colleagues that I work with that are incredible and really have worked really hard during this early pandemic to, surf the waves of change as we try to change and to change our practice along with the needs of the people that are out there and that we work with. There are still, this is considered an essential industry, and there are still, while some people don't have to work here, obviously some are knowledge workers, there are still about 1,000 people that come in every day. So we are here to work with and to serve them.
So we're here mostly talking about how things have changed since the pandemic began, and how the professions that come in contact with people have had to adapt. So since I'm a minister, we've had to take all of our worship services and connecting with people online and virtually. And I know that there are folks that are doing things like therapy by the phone. I've actually had a doctor's appointment on FaceTime. So the way we connect with people in these fields is changing. So can you tell me a little bit about how it's changing where you work?
Absolutely. All the time that you've been seen by any medical provider, the best part of that visit is often the relationship, the meaning that you would derive by visiting with that person. That relationship can carry on, even if, as we know, even if you're using technology. You don't have to be sitting there in the office. You can interact directly and be of good advantage and receive really great care without necessarily being in the office. That's especially true for things like chronic ailments like high blood pressure and cholesterol and those sort of things, where you can talk with your provider, whether it's nurse practitioner or PA or physician, remotely. They can certainly look at things like your laboratory work and other kinds of items and make good decisions regarding your care. So learn to use those tools. It can be, and in many cases, is just as simple as using FaceTime on your phone. You can communicate that way. Mike, you had said you had a visit. It might have been on FaceTime, actually, or something similar to that. Many of the electronic health records, including Epic, it's one of the larger ones, have a built-in component, a platform. You might have to use a portal arrangement to get to your provider. They use that so they have your medical records available directly to them. They can look at those medical records while they're visiting with you and can then see you and talk about the conditions that you might have. Now, truthfully, there are some conditions that you can't do from a video. I can't sew a laceration up from a video. I have to actually see you. I can't draw your blood from a video. I have to lay my hands on you. And so in those times, it may be time to go in. Certainly if you feel like you are very ill, if you're having chest pain, you're having any condition where you're short of breath, it's incredibly important that you go ahead and go to the emergency room. You don't want to hold off for fear that you might be exposed to COVID or to some other issues out there and not get the adequate care that you need. Emergency rooms, doctors' offices are going to incredible lengths to make sure that their offices are clean and as well protected and can protect you if you have to go in. There are certainly some changes with COVID. You may visit with a video visit, and in a video visit, fortunately, I don't have to wear all the garb that I'm going to be wearing when I see you in person. Today, if I'm seeing you in person, I'm going to be wearing my N95 mask if I've got them, or something in similar to this. There are a couple of different things out there, and we can talk about that. But more than that, I have to protect my eyes. I am old enough to need lineless bifocals, and so to protect my face and eyes, I also wear a face shield that looks like this. So when I visit with you, I'm going to be dressed in all of this garb. It may be that when I do my initial assessment, I may actually be standing away from you. So I'm not using my PPE as long. If I can stay 6 feet away or so, I may be able to talk to you then, or look at what's troubling you. Certainly a rash could be viewed in some cases that way, and there's other things that can be treated that way. So you may see that if you go in, certainly in the next several months, that people will see you that way. If you are coughing, if you are sick, also be prepared to be screened. Your doctor's office will likely call you or expect you to call them and to say the questions: do you have a fever? Do you have a cough? Are you short of breath? All those things that may indicate that you've had an exposure. And they will want to limit their time that they would spend with you in those circumstances. But it doesn't mean that you don't seek out care if you're ill. Please understand that we want to see you. We want to take care of you. That's why we went into the profession. This is as new to us as it is to everyone else. The other thing I would prepare you for is that there are some providers out there that are excellent with their technology. They really know how to make this stuff work and can do really well. Some not so much, so be prepared, and please be as gracious and patient with your providers as we are hopefully with you as well. I would tell you that if you do have to have a video visit, try to be in a quiet space where you feel comfortable with talking about what's going on. That provider should be asking you questions, oftentimes some very personal questions, and you don't want to be rattling off those answers if you're in the grocery store, or if you're, depending on where you are, right? So keep that in mind. I think a lot of us are discovering the joys of having your cat walk in when you're on the teleconference. That may be just a minor annoyance, but you do want to be aware of where you are when you do visit with your provider.
Yeah, and it seems like in my profession, we've seen a lot of churches scramble to get online, and some are not good at it, and they haven't really ramped up to this crisis. And the ones that have been doing it a while are really good at it. So I guess you're saying the same thing, but we're finding that in the medical field too. There's some practitioners that are really good at it, and some that are needing to learn.
Right. And it's hard to know whether you are the first patient or the 20th patient, or how many other patients down the road, while we get accustomed to this, to the changes in the way that we deliver care as well.
Yeah.
Couple of things to be aware of too. Being able to take your own temperature. Learn how to take your temperature, how to check your pulse, how to make a note about whether that pulse rate is regular or not. How to be within your own skin about are you wheezing, or do you have other kinds of symptoms of cough that's going on. Your provider will want to know that information. If they can do gather some of that data from you, they're going to record it in your record and take your word for it. So I do encourage you to do that. I also know that currently it's very hard to find a thermometer. That sometimes they're available, sometimes they're not. It can be a challenge to do so. You may be able to find them in other circumstances where you can purchase those items. Certainly the CVS's and the Walmarts and all of those places will eventually get restocked, but I don't think anybody anticipated the need to check our own temperature at home as frequently as we are now having to do. If anyone needs help with learning, if you have a glass thermometer with the mercury bulb, those are still out there and people have them. If you don't know how to read them, ask me. We can talk about how to make that work.
Right. So part of this is when you showed the face shield and all of that, things have changed. We just in the faith world, we're learning about being online and getting folks to feel like they are part of a faith community online. Um, and then I realized recently that at some point the pandemic will end, and we'll have to go back to normal. Uh, but we're really being a new normal. There's no going back to the way things were. And so in this new normal, are we going to use some of these things that we have learned in this pandemic and go forward with them? Like, for instance, I really needed to be more present to the online community. When we were recording our services online, it was sort of like people online were overlooking the worship that was in the room, but not really welcomed into the room. And so now I realize when I get back, there's going to be a lot more people online that are going to need to be welcomed and feel a part of what's going on. And that
Absolutely.
some may choose not to come back to a setting and may prefer to do it online. So what do you see as coming into the medical profession that will carry over from this pandemic?
So I think one of the things that you will see is you'll see a persistence in use of some of the PPE items during visits for the next several years. You may see, and I think we'll all see, masks that are either mass produced or they're produced by family and friends, if nothing else, just to keep droplet spread for this kind of illness. So just realize that's going to continue to go on. I think we'll see it for some years. Eventually, though, we do want people to come back and be able to come back to the medical offices. But just as Mike has observed, I think this rapid and vast expansion of the use of telephonic and video visits for the medical profession will also stay. You'll find that there will be a level of convenience to it that didn't exist in the past. And so being able to see your provider without necessarily having to get in your car or spend time in the waiting room, that's not a disadvantage. That's an advantage to people as patients. And so if I can use my knowledge to help you and to do that through a format that's both safe and convenient for you and me, then we both have won.
Well, thank you so much for giving a couple minutes of your unbelievably busy day and time. Is there anything you'd like to leave us with that we need to know as we continue to go throughout the next weeks and months during this crisis?
There are some things that I think that you need to know. If you haven't spent a little time on the CDC website regarding COVID, I would strongly encourage you to do so. There's a wealth of information about the illness, about how to create things like masks that you may find useful over the next coming days. There's information about how to become prepared. Realize that you may have somebody in your household that becomes ill. What do you do? What plans do you need to make? Do you need childcare? Are there other things that you need to have pre-thought out if you need to isolate within your own home? Be aware that this will not be even if we flatten the curve, and I'm sure that you've heard that phrase now, means that it'll slowly move through our population in a lot of different ways. So I would encourage you to take a moment to look at the how to prepare yourself at home information that the CDC offers. You can trust the CDC. It's absolutely a wellspring of knowledge and can help you to get through this and to make better plans as we move through this crisis.
Well, thank you, Jamie. I appreciate your time and your expertise and for helping us to understand the environment a little bit more. And we're glad that you're on the front lines and we're praying for you.
I do ask for your prayers, and I'm going to ask for prayers for really many of my family. Some of you may know that Melissa works in a hospital as well as a chaplain, educator, and reverend at Children's Medical Center. Our daughters, Amy and Amber, have grown up to be registered nurses. Amy works at Parkland. Amber works at Baylor. Our son-in-law is also a nurse. He has a home health organization. be in prayer for us. We are working hard to do things the right way. We are using great care and caution to keep ourselves safe, and we are seeing patients every day.
Well, we will definitely do so and pray for you all and all on the front lines. And we thank you from the bottom of our hearts. Thank you for being with us.
All right. Thank you, and thanks for having me.
You bet.